We now come to the statement. I call the Secretary of State for Health. Secretary of State.
Thank you, Mr. Speaker. With permission, I would like to make a statement on Lord Darzi's investigation into the NHS. Unlike the last holders of this office, this government will be honest about the problems the NHS faces and serious about fixing them. That's why I asked Lord Darzi, an eminent cancer surgeon who served both Labour and Conservative-led governments with distinction, to conduct an independent investigation into the state of our National Health Service. I'm sure the whole House will want to join me in thanking him for producing this expert, comprehensive report, a copy of which I've placed in the library of both Houses. Mr. Speaker, I told Lord Darzi we wanted hard truths, warts and all. His findings are raw, honest and breathtaking. He says, and I quote, "Although I have worked in the NHS for more than 30 years, I have been shocked by what I have found." He has uncovered an enormous charge sheet, too long to list in this statement, so these are just a few. The NHS has not been able to meet its promises to treat patients on time for almost a decade. Patients have never been more dissatisfied with the service they receive. Waiting lists for mental health and community services have surged. 50 years of progress on cardiovascular disease is going into reverse. Cancer is more likely to be a death sentence for NHS patients than patients in other countries. And it's not just the sickness in the NHS that concerns Lord Darzi, but sickness in society. Children are sicker today than a decade ago, and adults are falling into ill health earlier in life. It's piling pressure onto our NHS and holding back our economy. Those are some of the symptoms. The report is equally damning on the causes. First, a decade of underinvestment, which left the NHS 15 years behind the private sector on technology, with fewer diagnostic scanners per patient than almost every comparable country, including Belgium, Italy and Greece. And mental health patients treated in Victorian buildings with cockroach and mice infestations, where 17 men are forced to share 2 showers in 2024.
Shocking.
Second, the disastrous 2012 top-down reorganisation overseen by Lord Lansley. Lord Darzi's assessment is damning, which I will now quote. "A calamity without international precedent. It took a scorched earth approach to health reform. By 2015, ministers were putting in place workarounds and sticking plasters to bypass the legislation. Rather than liberating the NHS as promised, it imprisoned more than 1 million NHS staff in a broken system for the best part of a decade. The effects are still being felt to this day." Mr. Speaker, just imagine if all the time, effort and billions of pounds wasted on dissolving and reconstituting management structures had instead been invested in services for patients. Clearly, the NHS would not be in the mess it finds itself today. Third, coronavirus. Everyone can see the lasting damage caused by the pandemic. But until now, we didn't know that the pandemic hit the NHS harder than any other comparable healthcare system in the world. The NHS cancelled far more operations and routine care than anywhere else. As Lord Darzi writes, and I quote, "The pandemic's impact was magnified because the NHS had been seriously weakened in the decade preceding it." In other words, Mr. Speaker, it's not just that the Conservatives didn't fix the roof while the sun was shining, They doused the house in petrol, left the gas on, and COVID just lit the match. That's why waiting lists have ballooned to 7.6 million long today. Fourth, the failure to reform. I wouldn't complain about the diagnosis. I take responsibility if I was a party opposite. Fourth, and firmly at their door. So sit and listen. Since 2019, the previous government oversaw a 17% increase in the number of staff working in hospitals. Did it lead to better outcomes for patients? No. At great expense to the taxpayer, the NHS has instead seen a huge fall in productivity. We paid more but got less. A deplorable waste of resources when so many parts of our health and care services were crying out for investment. As Lord Darzi puts it, British Airways wouldn't hire more pilots without buying more planes. Doctors and nurses are wasting their time trying to find beds for their patients, dealing with outdated IT when they ought to be treating patients. Too many people end up in hospital because they can't get the help they need from a pharmacy, GP or social care. And the effective reforms of the last Labour government, which drove better performance and better care for patients, were mostly undone. That, Mr. Speaker, is why patients can't get a GP appointment, an operation, even an ambulance when they need one today. That's what they did to take the NHS from the shortest waiting times and highest patient satisfaction in history to the broken NHS we see today. Now, Mr. Speaker, Lord Darzi has given his diagnosis. It's over to us now to write the prescription. And we have three choices. The first is to continue the Conservatives' neglect and allow the NHS to collapse. That's the path they set the NHS on today. We could, as some of my critics on the left demand, pour ever-increasing amounts of money in without reform, wasting money that isn't there and that working people can't afford to pay. Wasteful and irresponsible. We will not take that path. This government is making a different choice. We choose recovery and reform, taking action today to deal with the immediate crisis by hiring 1,000 GPs the Conservatives had left without a job while patients are going without an appointment, and agreeing an offer to end the strikes that they allowed to cripple our health service. At the same time, we will introduce the fundamental reforms needed to secure the future of our NHS. Earlier today, my right honourable friend, the Prime Minister, confirmed that the government will publish a 10-year plan for change and modernisation on the foundation of Lord Darzi's report. Our plan that will deliver the three big shifts needed to make our NHS fit for the future. First, from analogue to digital, giving patients proper choice and control over their own healthcare. Finally realising the untapped potential of the NHS app. Fully digital patient records so your surgeon can see the notes your GP writes. And by marrying our country's leading scientific minds with the care of over 1.5 million NHS staff, we will put NHS patients at the front of the queue for cutting-edge medicines and treatments that we can only imagine today. Second, from hospital to community, turning our NHS into a neighbourhood health service as much as a national health service, so patients can get the tests and scans on their high streets, be cared for from the comfort of their own home, bringing back the family doctor, and building a national care service that can be there for us when we need it, able to meet the challenges of this century. Third, from sickness to prevention, taking the decisions they ducked to give our children a healthy, happy start to life. From stopping the targeting of junk food ads at children, banning energy drinks for under 16s, reforming the NHS to catch illness earlier, starting by offering health checks in workplaces and on smartphones, and delivering the tobacco and vapes bill that they failed to pass to tackle one of society's biggest killers. Mr. Speaker, Lord Darzi's diagnosis is that the NHS is in a critical condition. Unless we perform major surgery, the patient will die. But he also finds that its vital signs are strong, an extraordinary depth of clinical talent, a shared determination to improve care for patients, a public service free at the point of use, so that whenever we fall ill, we never have to worry about the bill. The NHS is broken, but it is not beaten. Every person I've met in the NHS during my first 2 months as Health and Social Care Secretary is up for the challenge. It will take time. But, Mr. Speaker, this party, the party that created the NHS, we've turned the NHS around before, and we will do it again. I commend this statement to the House.
Shadow Secretary of State Victoria Atkins.
Point of order.
Has the member been here? Points of order come at the end, and you can't intervene in the middle of this. Victoria Atkins.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance notice of his statement. The NHS belongs to us all, and we all care about it. So let's stop the political posturing and talk constructively about its future. We all know that our healthcare system faces significant pressures, as do all health systems around the world. We are living longer and with multiple and complex conditions. We have wider societal pressures, such as the impact of social media on the development of some young minds, as well as the treatment benefits that cost pressures of miracle drugs developed by our world-class life sciences sector. And the shock of the pandemic has had catastrophic impacts on the NHS and its productivity. Now, I believe there is much to be proud of in the NHS. Its dedicated staff look after 1.6 million people a day, 25% more people than in 2010. It has more doctors, more nurses and more investment than at any point in its history. It is delivering tens of millions more outpatient appointments and diagnostic tests and procedures for patients than in 2010. And of course, we delivered the fastest rollout of vaccination for COVID in the world, freeing our society more quickly than other countries. And we have more healthcare in the community, with the opening of 160 community diagnostic centres, the largest central cash investment in MRI and CT scanning capacity in the history of the NHS, as well as 15 new surgical hubs and the launch of Pharmacy First, helping to free up to 10 million GP appointments with those living with more complex conditions. I would just say to the Secretary of State, I paid him the courtesy of listening to him in silence. I hope he would do the same to me. He was chuntering from a sedentary position. But we on this side...
Order. Can I just say, I want to hear the Honourable Lady. Your constituents also want what's being said. So please, let's give the same courtesies that I expected for the Secretary of State. Victoria Atkins.
Thank you, Mr. Speaker. Now, we on this side of the House have never pretended that everything was fixed. We haven't pretended that we have the monopoly on wisdom or that there are easy answers to the difficult challenges we face. For the NHS to thrive in its next 75 years, it needs to reform, modernise and improve productivity. This is why the Conservative government, working with NHS England, announced the NHS Productivity Plan at Spring Budget to transform how the NHS works through better IT systems for frontline staff, expansion of services on the NHS app, which is used by 3 out of 4 adults today in England, and the use of new technology, including voice-activated AI. Together, this would see productivity grow by 2% a year by the end of the decade and unlock £35 billion worth of savings. Yet it is not mentioned in the 163-page report. Why is such an important and forward-looking reform missing from this report? And can the Right Honourable Gentleman confirm that he is choosing to cancel it? A simple yes or no. New medicines and trials are an essential part of the productivity challenge. There is only one mention of NICE in the 163-page report. Again, does the government have a strategy for life sciences and the provision of rare medicines, including cancer and dementia drugs? And why have they paused the Childhood Cancer Task Force? This need for reform is also why we implemented the first ever long-term workforce plan with NHS in England to train even more doctors, nurses, midwives and other healthcare staff for the future. This plan was described by the NHS CEO, Amanda Pritchard, as, and I quote, one of the most seminal moments in our 75-year history. Yet it is not mentioned in today's report. Again, why is such an important and forward-looking reform missing from this report? Is the Right Honourable Gentleman going to cancel the new places and forms of training, including apprenticeships, that were to be provided through that plan? The need to modernise is why in 2019 we announced the largest programme of hospital building in modern history, 40 new hospitals across England by 2030. I'd be careful for some of these backbench MPs. Today, 7 new hospitals have opened. The Midland Metropolitan will open at the end of the year, and I imagine the Right Honourable Gentleman will enjoy going to its launch. And a further 18 are in construction, and we're not even halfway through the decade. But since January 2023, it has been Labour's plan to pause, review, delay, and presumably, possibly cancel these new hospitals. They published their health mission then. It's on page 6 for those that haven't read it. In other words, this was always their plan to delay and possibly cancel new hospitals, and nothing to do with the Chancellor's questionable accounting since the general election. When this was pointed out in the general election campaign, Labour candidates ran around promising voters that their new local hospital or CDC was safe with them. In Torbay, Chelsea and Fulham, Basingstoke, Watford, Bracknell, Truro, Corby and Kettering, to name a few. Will the Right Honourable Gentleman confirm that Labour will delay these hospitals? And there is one...
It's difficult, but it's 5 minutes. It's now 6 minutes, 22 seconds. We're well over. Can we now conclude on that sentence? Thank you.
Very much. Thank you, Mr. Speaker. And there is one part of Great Britain where on almost every measure the NHS performs the worst. Labour-run Wales. The Right Honourable Gentleman has compared... I'm
sorry. I meant you conclude now, not to continue with the rest of the speech. Secretary of State. No.
Thank you, Mr. Speaker. The first word the Shadow Secretary of State for Health and Social Care should have said was sorry. She says she never pretended everything was fixed, and that's true, but it's about time that she admits that it was their party that broke the NHS in the first place. In fact, it's been a feature of debate in this House since the general election that the party opposite has taken absolutely no responsibility whatsoever for the mess they left our country in. A £22 billion black hole, a new hospitals programme she refers to, where the timetables were a work of fiction and where the money ran out in March. She knew that. She knew that when she went to the country to claim that the programme was fully funded. She talks about the decisions made by NICE, a new Labour reform and modernisation, thankfully one that did survive the last 14 years. And you know, Mr. Speaker, she's endorsed the Right Honourable Member for Newark in the Conservative Party's leadership election. I wonder what she makes of his admission that the Conservatives failed to make the tough reforms the NHS needed because they were afraid of what Labour might say. Is that not the most derisory excuse for 14 years of neglect? Mr. Speaker, my predecessor does not bear responsibility for everything in the Darzi report. This crisis was more than a decade in the making, but I wonder when she will show some humility on behalf of her party and apologise for the mess that her government made of our National Health Service. Otherwise, why should anyone trust what they have to say ever again? This government was given a mandate for change, and nowhere is that more needed than in our NHS. This report must mark the beginning of the long, hard work of change. It is the platform from which we will launch a decade of reform that will make sure the NHS can be there for us when we need it, for us, our children and our grandchildren. And, Mr. Speaker, in conclusion, it must draw a line in the sand so that we never go back to the pain, fear and misery the Conservative Party inflicted on millions of patients.
Yeah.